Oh! Holy cow. Puncture wound to your left flank. Anybody out there know what's in your left flank? You have your spleen that sits there. Then you also have your descending colon. Further back, you end up having your ureter and your kidney. High up there, you might actually even catch the bottom of the lung. Puncture the diaphragm if you puncture the lung, a pneumothorax. If the diaphragm actually gets ruptured, the contents of your abdomen could actually go up into your chest cavity. We actually see this often when people have different types of hiatal hernias. Oh, jeez. Oh, man. I believe that's the Demogorgon.
The Demogorgon!
Correct me if I'm wrong, it's fine.
The Demogorgon is tired of bickering!
Going after the chest and the heart. We saw all those teeth, and so it's able to break down the chest wall, get into the heart, versus like you'd think they'd go after the head or the face.
In your face!
We see penetrating traumas, we would have to do our trauma protocols. A, B, C, D, E's, they fit just in the A, B, where you worry about the airway because of the lung, and then you do your C's because blood pressure, heart rate, blood loss, all related, could have a major effect relating to your splenic type injury on that left flank. Ooh. Bleeding from the mouth, teeth look a little broken. Most of the time, like the lips will bleed because they hit our own teeth and it causes laceration that way or explodes open. The things we worry about have to do with through and through, like cut on the outside as well as the inside. Could be a lot of bacteria. It just has a higher risk for infection.
Go to
Oh, heavy metal and a lot of weight to it. If it hits the nose, you could fracture the nose, cause bleeding, and you might pass out. If it hits your forehead, you have your frontal sinuses there, so you can break both the outer and the inner part of the frontal sinus. You can crack all the way into the skull, puncturing brain tissue with your own bone. Stab right above the manubrium. If you puncture straight into the airway, you're having the airway issue. Esophagus, you got to worry about infection because now there's the junk from our eating and mucus getting into wrong cavities, and then the airway as well, especially if the junk gets into the airway. Oh, geez. Oh. It's so funny in movies, they use silencers or suppressors, right? They'll have some sound that goes off, but I guess if there's enough noises around, it gets hidden in there. Oh, okay. We're shown this is a lower sternum epigastric area injury, really directly where your heart is. So your heart is centered to the left, but this definitely would go straight through the heart or structures very close to it. Or it might be low enough that it's just in the epigastric area. If it hit the heart and ruptured through one of the chambers of the heart, what happens is the blood escapes into the mediastinum, which is the space where your heart is. It'll then compress your heart down to where you're not pumping any more blood out. Versus here, he's awake, complaining of pain.
Easy.
Could be your stomach, but the other things you worry about is your aorta that comes behind it on the backside, which is your major blood vessel. That could cause significant bleeding and you can die pretty quickly. If this doesn't take your life, then the issue ends up being infection, blood loss, and the recovery aspect. You as a bystander, what would you do if you were in this scenario? Obviously, you gotta call 911 and then be with the individual as long as the scene is safe, and you wanna compress the area as best you can. Oh my gosh, huge. You ever watch a show like Stranger Things and have the hairs on the back of your neck stand up? You're definitely not alone. That's why I created Chillax to help you stay calm when things get a little more intense. Find it at lifehappens.com or on Amazon. Ow, he's got his hands in there. The hands might be getting eaten. The tissue might be sloughing off. We see that when people get burns. We see that when people get bad road rash. Sometimes there's something called degloving where the skin gets pulled off. Puncture wounds, so we get puncture wounds to either side because of the claws. So liver, spleen, get potentially injured, fractured ribs, as well as punctured lungs. I mean, if somebody comes in, there's gonna be a lot of work that needs to get done.
We have important work to do.
Oh my gosh. I'd be freaking out. Has anybody levitated in their life? Let me know in the comments. Chris Angel, right? Chris Angel, if you're watching, show me how you do it. Oh! That is a fracture dislocation of your elbow. Why do I say fracture? Because the way your anatomy is, to be able to hyperextend it in such a way that causes it to snap like that, you wouldn't be able just to dislocate it. You'd have to snap the olecranon off, which is your elbow piece, but then it will dislocate out of socket after that because now you don't have a socket. This leg just gets totally destroyed. Tib-fib fracture, so the tibia and the fibula fractured. Again, you need to splint that in the appropriate anatomical alignment when it comes in because of the vasculature, plus it'll help decrease the bleeding. Oh my gosh. Nice jaw fracture versus dislocation. Most jaw fractures occur in two places because you get hit on one side and the energy goes out the other. So you typically have one fracture here and then the other side going through. Stranger Things. Oh my gosh, it's so scary. So why did the nose look like that? We see that depicted in many different shows, movies. The tip of our nose is cartilage, but the rest of it is bone. So the cartilage is gone, the connective tissue is gone, but the bone is still there. So that's why we see that. You just hear the crunching and the breaking of the bones. Most of the time when we see people with massive, multiple fractured injuries, it's due to falls from great heights or bad car accidents. Those are usually what we see. Would all these broken bones cause you to die? No, not necessarily. You do worry about blood loss and inflammation. Every bone has blood running through it. Eventually, you're going to have a significant amount of bleeding when you have fractured bones, if there's a lot of them. Airway, breathing, circulation, you're supporting the individual, getting things realigned so then you minimize blood loss. Wow, take a look at this face. Okay, yes, I know it's a creature, but just looking at the nose itself.
Your nose!
A nose looks like this when you've actually lost all the tissue and the cartilage of the normal part of the nose because the rest of it is actually made up of bone. You do see this in sometimes traumatic injuries or people who have had cancer, skin cancers commonly in this area. You can have some septal defects, you can have necrosis. Oh my gosh, some levitation going on.
Levitation, Holmes!
Sometimes I think patients at the hospital feel this way, that they're on like another planet, they're floating. When people get morphine or Dilaudid or any opiate, they actually have a sensation of floating and feeling very light. Oh, what the hell was that?
What the hell is even that?
Massive claw into the face, and anatomically it's still realistic. We're having the PIP joint, the DIP, the normal way the hand would appear, just on a larger scale. Massive fractures, dislocations. I have seen people come to the emergency department with MAC 2, sometimes 3 dislocations of different joints. Usually it's one big joint that takes most of the hit. Elbow, a knee, a hip. Sometimes we even see as simple as like finger dislocations or even toe dislocations. First injury is like a bite wound decapitation. In emergency departments, we don't deal with bite wounds like this, but we do deal with rattlesnake bite wounds that I see in Southern California, domestic animals and stray animals. Always really good to take photos if you can, so that way we can identify what got you. Oh, nasty puncture wound, as well as traumatic like injury to the abdomen. People do get traumatic blunt injuries. Most of these are car accidents that we end up seeing for blunt traumas or people getting hit by a car. Remember, airway, breathing, circulation, disability, and exposure. That's what we're looking for in the primary assessment. Oh my gosh.
Oh my goodness.
If somebody had a traumatic injury that their face actually ended up looking like this, you're gonna wanna manage the airway. You can easily put an endotracheal tube in a patient with massive facial trauma. Oh, to the dome. Taking impaled object to the head, right? Into the airway, mouth. We know that that would not be compatible with life for a human.
I'm a human!
But could you survive for a short period of time? Depends. If it's just getting your airway's gonna get compromised, and then that's going to have you succumb to your injury. Nice. These creatures are just getting destroyed by the flames. Issues of scar formation pretty fast where the tissue is melted. Individuals' chest walls are so rigid because of the scarring immediately that you have to do an escharotomy, basically where you're cutting the tissue and allowing the tissue to expand. Well, we learned that they don't like fire. Fire also takes away the oxygen around an individual. You will potentially breathe in the flames, which can melt your airway, which then will occlude your airway, or have delayed swelling, which again increase the risk of blocking your airway. Oh, cool. Arm gone right at the humerus. The humerus is now being cut right down the middle, so you're cutting through the bone, and you're bleeding horribly through the brachial artery that is sitting right there. That's the artery that you would feel in a baby, young child for their pulse. A lot of blood. Maybe right there we're seeing like the spine, the bones. We definitely know that there is a spinal cord and the vertebrae because of the previous back views that we've seen where all the ribs are attaching. And we see the spinous processes, those little nubs on the back. Smoking, not good for you, right? No benefit of smoking. Definitely increases the risk of cancer, shortens your life. So please do not smoke. Oh. Ooh. Taking a sledgehammer to the ankle, trying to break off this cuff. You're definitely getting destroyed at the ankle. Ouch. Big amounts of swelling, bruising to this area, and significant amount of pain. Strangulation, two things that we worry about. Airway compromise, you can break the hyoid bone, you can affect the trachea. Then you have vascular compromise, so you have those big major vessels on either side of the neck. You have carotid artery and the jugular vein. Oof, oof. So interesting, the abrasions that they have to their face. A lot of times when somebody gets punched in the face, you're seeing bruising or a laceration. You don't see these abrasions as much unless you're scraping on the ground or you have rings on your hand that's scraping across the face. Oh. Oh, man.
Oh, man.
This is how some people feel when they come in when they have their patella dislocated. When it comes to big dislocations like this, you worry about vascular compromise. All the blood vessels that run behind the knee. We'll put it back in and then we have to make sure the vasculature is intact again, most likely with a CT angiogram. Those eyes are all white. The white part of your eye is called the sclera. You have your iris and the pupil. When people get older, you can get cataract, which clouds the lens, deciphering between the anterior and the posterior chamber of the eye. Oh, good catch. If watching them fight all these interdimensional beings has your stress levels climbing, that's where Chillax from my company, Life Happens, could come into play. Designed to help you stay calm when life goes sideways or upside down. Find Chillax at lifehappens.com or on Amazon. We do get worried about bats and rabies. I don't think your local primary care doctor's office has that type of vaccination, so it's okay to come to the emergency department for that. Maybe give the emergency department a call before you head there to make sure that they actually do have it. Oh no. Eddie must have had catastrophic blood loss to cause him to have lost his life. Usually if you lose 40% of your blood volume and pass away, you're going to be altered, confused, cold, probably not going to be awake. It would probably be more of he's going to be unconscious but still alive and then slowly fade away. Oh, I don't want to be a dentist for that patient. Ooh. Normally, a shotgun injury to somebody's head is going to cause probably the head to just be partially destroyed, blown off, typically not compatible with life. You might still be alive enough to be an organ donor, those sorts of things. So you have to have that potential conversation when somebody comes into the emergency department. Oh! Falling from a great height, we talked about on the channel before. When you fall from a distance greater than 3 times your own height, increases the suspicion of a serious injury. Hitting tree branches along the way reduces the speed at which you're falling down, but you're still falling pretty high. As it gets pulled on the ground, the other thing that we worry about is road rash, basically. You're getting pulled over top of roots and broken branches and leaves. If your shirt comes up, you can start burning tissue away. We got no tissue around the nose here.
Your nose!
The nasal cartilage is gone. The soft tissue here is gone. So you just have the basic structure of the bone itself. Sometimes burns can look like this, or people who smoke a lot, they have increased aging lines and wrinkles to their face. Ooh, we got this thing going in his mouth. When we have people intubated, usually there's just a tube. One of the bigger tubes is the endotracheal tube, which is what's bringing air in and out of the lungs. And then we'll actually put an oral gastric tube in as well to decompress the stomach.
William, such beautiful things.
Almost looks like he might be having a seizure. He's got eyes rolling back. A lot of times people's eyes when it comes to seizures, they're still looking straight or they're looking a little deviated one way or the other. Ooh, blood to the back of the head. A lot of times we notice people fall down. A lot of in the elderly population, they don't realize if they hit their head or not. So we always need to examine their skull. Sometimes they'll have a laceration, might go through the skin all the way, sometimes not. Depending on your age, there's a likelihood that you're gonna get a CT scan if you're having blood from your scalp. Oh, trying to hold your breath underwater while your adrenaline is kicked up. Stress hormones that release in our bodies and cause us to go into our fight or flight scenario, which increases respiratory drive, heart rate, and blood pressure. It makes us more alert, makes us more aware. Whew, there you go. The faster your heart beats, the more demand it has for oxygen, requiring you to breathe. So it's really, really hard to hold your breath when you're in those scenarios. You really need to go into a whole other mental space to try to calm that system down. Yep. Woo! Oh, horrible trauma laceration to the mid-chest epigastric area. Looks like there's open skin, maybe organ exposure. You want to put a bulky dressing in this area, stuff it enough to where it's soaking up the blood on the inside, which could cause some compression. Control the bleeding, get the person to the hospital ASAP. How many of you have ever run around your house, slipped on the floor, and wiped out? You do increase the risk of breaking a hip, landing on your wrist, breaking a forearm. These are common injuries, so just be careful. Oh. If this was actually a human getting stabbed with a glass bottle, a lot of lacerations will cause a bunch of bleeding. Usually it won't go through the bone or deeper than that with these type of hits and that type of surface. I feel like it's just gonna stab her. Yep, hitting right flank, mid, so you're getting injuries to your liver, which if you puncture your liver, it's going to bleed a ton. You can have some rib fractures, you can have some diaphragmatic injury, and puncture to your lung, as well as puncture to your heart if it goes deep enough. Oof. Blood splattered all over the young lady here with the mouth and eyes open, so you could be getting somebody else's blood into your mucous membranes, which increases the risk of a bloodborne pathogen being transmitted to another individual.
What are you doing?
Get off the train tracks.
This is old age. Just give me some. No, hey.
Oh, stab wound, puncture wounds, or penetrating trauma. The right lower flank, your appendix, that's where it is. Could actually hit the lower part of your liver, but most likely this is all intestinal or just abdominal wall injury.
First clean, then disinfect, then bandage.
There you go, look at that. When somebody comes to the emergency department, we need to take care of the wound. We irrigate it using pressurized water. Most of the time when you clean out the wound really well, clean the skin around the area and close it up, they typically heal really well without infection.
Stop moving.
Yeah, well, it stings. It stings.
It means it's working.
We get this often when patients are complaining to us that it hurts. Using appropriate gauze here, this is just any type of rolled gauze, so that's pretty good. The only problem with it is it's dry and it can eventually stick to the wound.
Is it sticky?
Oh! Pedestrian versus car, very common reason why people end up at the hospital. You get your legs broken, intracranial bleeding, hemothorax, pneumothorax. Oh, laceration or puncture wound to the right lower chest area, liver, diaphragm, lower lungs. If they're hemodynamically stable, you do your fast exam, you get x-rays and you don't find anything abnormal, you have a little bit of time, but you're gonna get a CT scan. When you punch people in the face, it looks cool and you're trying to hurt them, but you're also gonna hurt yourself because the bones of your hands are actually fragile. A lot of people end up fracturing their hands. That's why it's literally called a boxer's fracture. Most of the time, the boxer fracture occurs on your 4th or 5th metacarpal. Oh, come on.
Come on!
Strangulation injury. You're compressing both the blood vessels on each side, so your carotid arteries and your jugular veins. And then you're also compressing your airway. Decreased blood flow to the brain, decreased blood flow in and out to your body. Ooh, get some scissors. She's trying to use her power, but oh, ow. Puncture wound to the humerus area. On the medial aspect, you're worried about the brachial artery. You can bleed out pretty good. It hurts a lot because usually if you hit that vessel, you're also hitting the nerve that's running right next to it. Barotrauma, ear trauma that is happening because of the loud noise without ear protection. You're gonna get tinnitus, you might have decreased hearing as well as disorientation because of the large bangs that are occurring.
I'll be quick.
Getting hit in the face with a gun, mostly metal, some have a little bit of polymer in certain parts of it. Your likelihood having a laceration, ecchymosis, hematoma, as well as the underlying structure is probably going to break, especially if you're getting hit in the maxilla there, which is your sinus. Whoa. Oh, Nelly. If watching all of these intense run-ins has your stress levels climbing, you might need a little occasional stress support. That's where Chillax from my company Life Happens comes into play. Designed to help you stay calm when life goes sideways or upside down.
Upside down.
Find Chillax at lifehappens.com or on Amazon. Oh, a flamethrower. Nice. If a flamethrower actually hits you like that, your flesh is going to be melted. Your airway is going to be toast. And it's not going to be compatible with life. The oxygen is gone around you. You're going to be breathing in the flames. I hope you're going to pass out because you shouldn't be in that type of agony. Oh my gosh, so interesting. Feeling the pain of being on fire. People do survive these scenarios. We want to get them sedated ASAP because of the pain. So we'll end up intubating patients quickly. You might as well intubate early because you can get delayed swelling of the airway and then you don't have the ability to actually put an airway in because it's all swollen shut. Oh, I wasn't expecting that. That hand is way all the way through that face. It's just funny because we really like to go right through the eyes, maybe because it's like the easier access point. That is definitely not compatible with life and would not show up to the emergency department because they would not be with us. Wow. That is gnarly. Looks like a tree.
I'm Groot.
Look at those whites of the eyes, that clouding, like opal. That means the corneas are quite cloudy for some reason. Usually infection that's causing that or chronic underlying inflammatory changes. Wow. If you don't get your tetanus shot, this is what's gonna look like. Your back's gonna be arched like that, you're gonna be pulled backwards, and you're gonna be spasming in all weird positions. No, I don't know 100% that's exactly what you're gonna look like, but that's what the textbooks tell us. We haven't seen tetanus in a very long time. It does cause your body to spasm in weird positions, and it's quite uncomfortable, so make sure you stay up to date with your tetanus vaccination. Oh, fractures of the arms themselves. We got fracture of the humerus. And these are what we call open fractures, open and displaced. Open meaning that they've broken through the skin, exposed to the outside world, and displaced because they're not aligned anymore. A lot of times they'll snap, go out of the skin, and then come back. But if they're still outside the skin, it is our job as EO doctors to put it back in as quick as possible. We got fracture of the radius and the ulna, stabilize it, splint it in place, and notify the orthopedic surgeon that we have a case that they need to take to the operating room. We need to wash these out so they don't get infected. Snap, snap. Ultimately, what gets them all looks to be like a cervical fracture, separating the body and the head. If you have high cervical injuries in a human, there is the likelihood of a not compatibility with life, usually around C1, C2. Wow. 3, 4, and 5, you do get worried about respiratory issues because of the phrenic nerve that has to do with your diaphragm. People might need to be on a ventilator if they have a mid-cervical spine fracture, but a high cervical spine fracture typically are not compatible with life if they cause a cervical spine injury.
Can you lift it? Can you show us?
Oh, that's a big laceration across the chest wall. What we would normally do in this scenario, the bleeding isn't too bad. There is some blood pooling, normal. What we want to do is anesthetize the area and clean the wound. It'll actually help vasoconstrict the small blood vessels, so the bleeding will significantly slow down. I mean, that response is kind of everybody's response, even people in healthcare.
Yeah, it looks like just the right amount for a couple of bad scars.
Yeah, you're gonna definitely have a scar there. If there is an injury deeper, you need to do subcutaneous sutures, and that's when we typically will use absorbable sutures. Sometimes in the emergency department, if you're pressed for time, you can just staple this shut. Whoa. How quickly and easy. Putting some butterflies in. The only time we use butterflies like that in the emergency department are for blood draws, but they're making it look like these are IVs, which is not normal.
She needed my blood. She just kept taking.
Interestingly enough, they did take the blood with those butterfly needles versus injecting fluid in.
I can't think of her as a kind of vampire.
When we have to draw blood, patients are like, oh my gosh, that's so many vials. That is so much blood that you're taking out of my body. It's not that much. Typically, we have 10 to 12 pints of blood in our body-ish. When you lose a lot of blood, you become pale. You can have these dark circles. The color of your lips will go. The mucous membranes will change color. The best place for me to look is the conjunctiva, the red area underneath here. If you are anemic, it's going to be very pale. Whoa, whoa, wait, whoa, woken up, didn't want to be bled anymore. Scalpel laceration to the neck. If the scalpel is able to hit the carotid artery or the jugular vein, you're gonna have significant amount of bleeding. If it doesn't go that deep, because there are protective areas of the neck where it's overlined by muscle, then it's just gonna cause superficial bleeding. Plus or minus, did it get into the airway? It potentially could cut in and cause difficulty breathing. Scalpel, you can see how long that is. That is a 15 or a 10 blade. You're doing superficial stab puncture wounds to that area. It might be going in like a centimeter or 2, depending on the area of the chest that's actually being hit. Oh, they definitely freaked me out. This flower-looking thing with all the teeth in the world. That is a lot of canines. Canines are sharp teeth versus the incisors, which are in the middle, and then the premolars and the molars, which are in further back, which help with grinding and mashing versus cutting and ripping. Electrical? Yeah, wow. Oh, interesting. So it looks like we have an open fracture. So you're actually seeing maybe some bones sticking out. In the emergency department, we would try to put that back in, even though it's still dirty. Then splint it, stabilize it. You're going to cover it with some antibiotics and get orthopedics involved because they need to take this individual to the operating room to wash out that area. Just like we use energy to restart somebody, kind of the same idea. You're restarting some of the body's action potentials and nerves to get things firing, but it doesn't work quite the same on, say, like a human, or if a human is passed, trying to give them more energy, it doesn't matter. What is happening?
What is happening?
Enough energy, it's almost like the electric chair. You're gonna cause frying of the nerves, seizure activity, potentially kill the heart. The muscles are being burned, which increase the risk of breakdown of cells, which will release a lot of potassium, will then cause electrical abnormalities, cardiac arrhythmias, can lead to renal failure. Whoa! So cool. That is amazing. This anatomy is totally not normal. Strands that could be like small strands of muscle, but they extend and contract almost like your intestines. We can't do that. Oh, we're on a cardiac monitor. There's a pretty high heart rate without the numbers that I can see, and quite irregular. Slowing down because she's becoming hypoxic, and this is actually quite common. When you're losing oxygen and you're about to pass out, you're going to have a slower heart rate, and then if you don't get oxygen soon enough, you're going to go into cardiac arrest. Cardiac arrest! Oh, very cool. Oh! Ow. Snapping it. Looks like it's just below the knee. Proximal tib-fib fracture. Painful as hell. There's no skin to pop through, so we'll just call this an open displaced fracture. That needs to be hardwired back into place, likely with antibiotics, and washed out. What the heck is this? What is this like big structure that I'm looking at? Almost beating like a heart? What is that? Let me know in the comments.
Time for my vessels to lead us to a new world.
Oi. All of them have like this connection with something into their mouth. No idea. Like, this is not normal, right? But we do same thing when somebody is sedated and we need to breathe for them. We put the breathing tube in their mouth. Oh, bleeding out of the eyes. Bleeding out of the eyes looks so scary. It typically is not anything really dangerous unless the blood is coming due to the trauma of the eye. A lot of times we'll see tears that are bloody coming out of somebody's eye because they've had like some sort of nasal trauma or something related to a sinus.
I won't hurt you. Please, mister, don't shoot.
Who are you?
This gentleman has a head injury on the ground, bleeding from the right side, traumatic brain injury, could be bleeding inside, could have a skull fracture. Need to wash that off and see what the wound looks like. Typically, if somebody's confused after a head injury in the emergency department, we're going to get a CT scan of the head.
They sent you!
You're just confused. You need a doctor.
Oh! Took a gunshot wound to the hand. A lot of bones in your hands, right? Those are your metacarpals. Fracture right through there. Could go soft tissue and might miss and go straight through the hand. Would also cause injuries to the nerves themselves. That escalated quickly. Repeated damage to the head. He's getting blood splattered on his own face, which if there's any bloodborne pathogens, you increase the risk of getting that into your own tissue because your eyes, your mouth, mucous membranes, you can absorb the blood in if it's a decent viral load. This person's outfit is like red stripes, and so that was a thing back in hospitals in the past. The candy striper, they were basically like help in the hospital, like medical care activities, running errands, getting food. Holy cow. We don't see this very often. Sometimes in really horrific accidents, we'll see this. Gunshot wounds, bad car accidents. It's bleeding control if the patient's still alive. Significant amount of plastic surgeries in the future. Oh. Besides the glass causing lacerations, puncture wounds, you could have compressive forces of the explosion that can pop your eardrums, could cause your lungs to collapse. You can have something called tinnitus. You may not be able to hear well. Oh. Awful. Look at his face. Significant scarring, maybe some burns to the area as well. Burns themselves take a very long time to heal. And then you have extra scarring going on that area, which then causes the tissue to be extremely tight. Oh, gunshot wound to the face and the head, going straight through the brain. Depending on where it hits in the brain and in the face, does it actually kill you? If you miss, you go sideways, which can happen. You're left with disaster, but still alive.
No! Oh, Golly! Golly! Get
Oh.
bandages, please! Please
Keep pressure on the wound.
Good. Keep pressure on the wound, like a lot of pressure. People are like, oh, let me just put a little bit of pressure. No, you need to be a lot of pressure to get that to stop. But that looks to be like an abdominal wound. Shove shirts, gauze, whatever you can into the wound to try to protect it from pulling out.
Look at me, hang in there, okay? I'm here. It's gonna be okay.
If watching all of these intense run-ins has your stress levels climbing, you might need a little occasional stress support. That's where Chillax from my company Life Happens could come into play to help you stay calm when life goes sideways or upside down.
Upside down.
Find it at lifehappens.com or on Amazon. Oh, cool. Oh, snap. Literally.
Literally?
Snapped off that right arm. We got dark blood. Our blood's not that dark. What would you do if somebody has an amputation? Tourniquet it. Remember, bring the limb with you just in case there's an amazing surgeon that can do a replantation surgery. Oh, not compatible with life with that big of a puncture wound impaled into the back, going through where your heart would be, your lungs would be, and all the major blood vessels. That is huge. Massive amounts of flames. So if this flames were like in a human, you always worry about the melting of the airway, suffocation, because it's taking all the air from around you. We get concerned that, oh, it might have went into the airway, so we probably need to intubate sooner than later. Still alive. If you take this creature off of this spike, it will bleed out immediately. Remember, I always say, don't pull it out. It's because of this, because it's still tamponading the area and not allowing it to bleed out immediately. So it's slow bleed.
Back to it.
Oh, what the? Oh! Big mallet, piece of wood, crushing somebody's skull. Could it actually happen with enough continuous blunt trauma and force? Yes.
Yes.
Quite impressive that we actually see the eyeball actually protruding out. Holy cow! You're getting blood coming down. Obviously, the person's still alive. Manage the individual. Airway, breathing, circulation. You probably need to go on a ventilator. Obviously, there's going to be traumatic brain injury. But the ultimate question ends up being, will the person survive, and will they survive with a meaningful life?
I just don't know. It seems like you're trying to speak, but you just took a hell of a hit.
Might not be able to speak because the part of the brain that has been affected by the trauma could be the area of speech. There's an area called Broca's area, which has to do with speech, so it could be affected. We see this a lot when people have strokes, especially on that side in that area of the brain, and they can't express what they want to say.
I just popped your skull so hard, your eyeball just popped out.
We actually try to cover up the eye itself just to protect it. You worry about retrobulbar hematoma. Basically, there's a pocket of blood behind the eye pushing the eyeball out. If that does happen, it's an eye emergency because it's pushing on the optic nerve in the wrong direction.
The wrong direction! No exceptions.
Oh! Oh my gosh. Oh! What? I wasn't expecting this. Everything is just smooched and squirted everywhere. When you actually have just brain matter, it's actually just grayish white. Injury that doesn't come to the emergency department. But we do see people where part of their skulls might be removed, fractured open, and brains are coming out. Oh, what the? Come on. Come on. Come on. Well, obviously, they took my advice a little bit too extreme for when I say don't pull it out. And we're just stepping on some skulls. The colors could be because of just rotting flesh at different ages. Our skin changes different colors because of that. if I took the top of a toilet to my head, that porcelain's gonna knock me out, could cause even a cervical fracture. Obviously wearing this big helmet, and again, it's a walker, it's a zombie. Their effects of pain probably are lacking. Oh, right through your hand. But if you see, Spike went between the knuckles through the soft tissue. So unlikely that there's a fracture. If somebody comes in with an injury like this, we actually will get an x-ray just to make sure the bone was not hit. You do worry about nerve injuries because the nerves run along the sides. Do you close it up or not? So it's a puncture wound through and through. So you maybe want one side to be partially open so it can drain, just in case you do get it infected. You gotta make sure your tetanus shot is up to date. I don't think they have that for this. The skin is coming off, almost like rotted looking, abnormal colors. People will come in looking pale, white skinned because of lack of blood flow going through their body. Oh, geez. I mean, that zombie looks pretty ripped.
Pretty cut.
You can see the muscles, you can see the striations. There's no subcutaneous fat anymore, it's gone. The body breaks down and starts shutting down. It's gonna have an awful smell as well. You should be able to smell these walkers a mile away. Oh, whoa! Taking the butt end of a rifle to your face can fracture your jaw, break some teeth. Sometimes your tooth will go flying out of your mouth. Find it, rinse it off, but don't scrub it off. Maybe put it in milk, put it in Hank's balanced salt solution. If you don't have any of that, you can put it in your own mouth. And then get to the hospital ASAP.
Take me to the hospital.
Hey, maybe we can shoot our way past them. You guys still have guns. You have the ammo.
You have the guns, I got the ammo, and we're separate from each other. I'm pretty useless. Oh! Dracula type biting going on, and you're seeing blood kind of pooling out. In that area of the neck, if you're actually getting that much blood, you're probably hitting more of a major blood vessel like the internal jugular vein. Oh my gosh. Holy cow. I can't believe they show this on TV. Manually ripping somebody's cheek. Ouch. Typically, humans can't go through with it just because of restraint from actually doing that. On that side, there's a lot of muscles and then major blood vessels. And so you're ripping through the soft tissue and it's going to cause a lot of bleeding. Just think about the psychological trauma that occurs to this individual watching their friend getting their face ripped off. What could happen is it could actually freeze you up in the future in a certain situation where you need to act.
So come on. Honey, you can do it. Sam, honey, I need you to come with me. I need you to come with me. I want to.
Maybe the kid just couldn't move, paralyzed due to fear, and your body just won't move because of it.
I need you to be strong.
Oh my gosh. We'll see individuals where you have different types of facial traumas, and you'd expect that the facial trauma killed the individual. There are certain areas of the brain that if they are injured, there's no outward sign of injury to the individual. There could be some processing issues or some personality change that will only show over time. Whoa. Where did the bullet go?
Which way did he go, George?
Okay, so that individual is down and the zombies are taking over. Oh man. Whoa. I'm assuming the bullet went into his eye. We'll never be able to recover that. The eye trauma is done. There's no more globe. Now you just have a hole. But now the issue ends up being, where did the bullet go once it actually passed through the eye? Was it going at an angle that it went out the side, or did it go straight through to the back, going through brain tissue? In this situation, put pressure to the wound. Obviously, you can't get to the hospital at this point, so hopefully you're not having brain swelling due to the trauma, which can cause you to be altered. And then did it actually go into the balance center of the brain or into the brainstem? So balance center of the brain is your cerebellum. If it hits the brainstem, there's not a lot of survival because that's where all your autonomic nervous system type function is.
A horde's coming. Bug out now.
Ooh.
Oh, Jesus. We gotta get the hell out of here.
Oh no. Oh, that is the worst.
That's the worst. worse.
The arm is trapped underneath, pretty much like immovable object. Two choices: somebody comes up with enough strength to get that log off you versus cutting off the arm.
Get the mules out here. You! Get over here right now!
Let's get it off there. The concern of that type of injury is a crush injury, so a fracture of the humerus, shoulder, maybe a dislocation, and then also the breakdown of the tissue itself. You worry about rhabdomyolysis.
Where's the dick?
He's gone. It's just me.
It's just you.
Ow. Hard to see, but it looks like it is all the way down to the bone and there's no other tissue there.
I have to amputate.
Why she says you gotta amputate, it's like how you gonna salvage that, where you're gonna get muscle, where you're gonna get tissue to cover over top of it. So in this situation, you just need to cut it off.
What? There ain't no other way?
The only way to stop the bleeding is to amputate and cauterize the wound. Here.
From the elbow down, and they're putting a tourniquet above it to try to reduce the blood flow, but you can't cauterize the big major blood vessels. Maybe in the arm they won't be as big, but they're still going to be maybe just the size of your pinky or maybe a little bit smaller. You actually have to tie those off.
You got something for the pain?
It wouldn't kick in fast enough. We have to do this now.
Maybe the medications that they have there are only, say, like oral medications. So if you take an oral medications, it can take 30 to 45 minutes for it to actually kick in. Versus if we have it in IV or IM medications, usually a minute or two.
Oh, sorry, man.
Oh my gosh, like a blowtorch. You can heat up metal and then kind of touch it to those areas to cauterize it with a hot metal versus actually like a flamethrower.
I need you to hold him down for me.
Besides the pain of the injury, even putting a tourniquet on really tight hurts like hell. See the importance of books when you don't have the internet? The knife, saws. The saw actually is probably a lot better because of the teeth on it versus a knife that's just a straight blade. Of amputations that I've seen, it's usually a saw, maybe a wire saw versus a rigid saw. Oh, jeez. Oh. Oh, what is this, like concrete rebar? This could be straight through your spleen. This could be straight through the lower part of your lung, or it could be in the intestines right where it turns right there. The left side. The likelihood that it hit your kidney, it's a little bit too lateral. Definitely could have broken some bones of the ribs. That's probably where they're lower. Probably most likely lower lung or spleen. You can live without your spleen, but you know, you can't live if you're bleeding out on the inside. You're stuck to this hard piece of concrete, rock. The only way to get out of the situation is to pull it out, so to speak. But the only way to do that is to lift yourself off that. So I don't think this individual's got a good chance. He's gonna try to pull himself up with the... Yep. Ah! Run, run.
Run, Forrest, run!
Wow, that is impressive. Now you're gonna deal with rust. Hopefully his tetanus shot's up to date. It's not necessarily the rust, it has to do with just the pathogen on these things. Well, at least the horse is hanging around. Woo. So you haven't bled out yet, you're just in a significant amount of pain, but pain prevents people from moving. If you can muster up the ability to tell your brain to keep moving, you can get out of this situation. Whoa, wow, okay. Straight through the suboccipital, so back of the skull, into the mouth. If you're going with that blade, it's gonna most likely sever the brainstem. Our basic autonomic nervous system. We're not going to be able to have a normal function of our breathing apparatus or heart. I feel like all these characters need something called Chillax, one of my supplements. Definitely check it out for yourself, something that'll nicely help and aid in stress. Oh, What the hell? Oh my gosh, they're just heads, they're still alive, that's crazy. But they're infected. Will the infection pass on? You got open wounds. Dirty water is the pathogen that's causing this in there? Let me know in the comments for all of those Walking Dead buffs out there. Oh, get the glass, use it as a knife. You might cut your own hand, but potentially gonna save your life. Yep, there you go. Whoa, that's gonna hurt. Oh, right in the eyes. Not a lot of blood in the eyeball itself. It's mostly fluid, but there is blood to the back of the eye that's supplying the eyeball itself. So there could be some bleeding, but they always make it seem like there's a lot more blood going on. It's mostly fluid. Oh, and even smarter, snap it off. It depends on how far that piece of glass went in. Did it go just through the eye socket, not to the brain itself? Is it into the frontal lobe or into the temporal horn? So these two areas.
What the hell are you gonna do now, sport?
Stop it. They always say that biting through a bone or a finger is like biting a carrot, but there's a human component that prevents you from doing that full bite. They're saying you're able to bite deep enough to hit the jugular vein, not super easily accessible. If you rip open the vessel itself, you're not going to go down that easy, that fast. You will bleed, but your first instinct is going to be to try to get it to stop. Just don't compress both sides because then you decrease flow out.
We get to come back.
Nope.
Liar.
Oh my gosh. It's a partial amputation or decapitation at this point, hitting the major blood vessels of the right side of the neck, including the carotid artery and the jugular vein. There's not much bleeding going on yet, and he's still aware because he's totally not decapitated and his spinal cord is intact. Oh, shot to the upper thigh. A lot of meat there. Hopefully it didn't hit any major blood vessels. Most of the time, by that point, the major blood vessels are trying to cruise behind the femur itself. Oh, see, he's still alive. Good job, whoever created this. Not totally bled out yet and is still trying to survive. Nope. Now I change my tune. A lot of force. This blade needs to be pretty sharp. Maybe soft tissue, no problem if it's not the sharpest, but to cut through bone, it needs to be really sharp. But again, you can hack away for a while.
Poster.
Eh.
Don't you ever besmirch Billy.
Oh, whoa, 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 whoa. Where'd you go? Oh, the slow down speed and blood is, whoa, cool, not cool. I just see a lot of blood.
Blood?
We got lots of blood in our body, right? Many liters, many pints of blood. You can survive, maybe if you lose just about half, you're at the cusp of like death and survival. What are we looking at? It almost looks like when I went and saw Body Worlds or Body Exhibit where they do the plasticization of humans, like anatomy, and it's just the blood of the body, all the blood vessels in a liquid casing. That's kind of like what it looked like.
I can't stop. 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 I can't stop.
What the heck? It's like very dark blood. So most of that blood was probably venous blood versus arterial blood, which is a lot brighter. Robin? Oh my gosh. Robin? That is awful.
That's awful.
On the arms, the tissue, appropriately shown, it's not just like perfectly cut off, it's all jagged. When somebody gets an amputation, and if the tissue is all kind of rough and beat up, it's very hard to reattach, versus if it's perfectly cut.
Шлюха не в себе, ненормально.
Oh.
Пиздец!
What? 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 Oh my gosh. Ripping off the skin of someone's face. The amount of strength that it takes is a lot. You got to be able to dig into the tissue, rip off the skin. But looking at the anatomy, they did a pretty good job. Teeth, obviously, you can see some gums. The nose. Your nose! Probably difficult to recreate because the nose is bone only at the top part and then it's cartilage down below. Oh. Oh, what is, come on. Come on! The classic like cervical fracture. High cervical injuries can cause the autonomic nervous system to cease to function and don't get any signal pathways to allow yourself to breathe or to have your heart beat. So that's typically how somebody dies in this circumstance. Oh, bullets, useless, bro. I would just run. She was shot several times and nothing happened. Just because you got shot doesn't mean something bad's going to happen. You can have soft tissue injury, goes through and through, doesn't hit anything. It could hit the bone, it could hit a major blood vessel, even though it looks like it's just going through flesh. What? What? Did that gun just get impaled right into his forehead? The amount of strength to be able to break through the bone with a very blunt object like that. I've never seen injuries like that. Obviously, I've seen bullet wounds, but not blunt trauma from a weapon that's stuck inside someone's head. Whoa, gross. Acid vomit or something like that.
It's got a wonderful defense mechanism.
Oh, gross. It is. Oh. Vomit on your own face? The pH of our stomach contents is quite low. It's very acidic. You can get ulcers, and then we have to give medications that potentially change the acidity environment. But if we're changing the acidic environment, then we're changing what's naturally supposed to be going on in your body, and then how you digest food might be changed as well. How did that acid kill the individual? Your GI tract can tolerate it. So did it go in your airway and your airway can't hack it? And then is it melting into your brain and is it dissolving your brain? Oh, that's pretty good. A headbutt to the face and the nose, and they actually show that there's like an laceration to the nose. Okay, I'm impressed.
Impressive.
Oi, oi. I don't think there's anything left with that strength. With that amount of punching and trauma to the face with this guy's right hand, you can fracture all this area of your face, all the bones around your eye, the zygomatic arch, the frontal bone here. You can do this sinus pocket right here, part of your maxilla. Normally, the most common car accident type injury is literally a pedestrian versus a car, not a pedestrian and car getting dismantled by superpower eyeballs. Oh, man. I don't know what this like goopy clotted blood looks like. Maybe it got clotted because of the amount of burned energy. Typically it wouldn't be sloppy Joe mixed like that. Your brain material would actually be a lot more gray white. It wouldn't just be all red coated in blood like that.
Where's my son?
Oh, wow. Cut in half. It reminds me almost of like Mortal Kombat. You can see the different brain material. You can see the cerebrum, the cerebellum. I'm assuming everybody's, yep, he's coated in blood. Oh, geez. If somebody gets exposed to another person's blood, especially if it's a mucous membrane, you want to wash out those mucous membranes. And if it's a needle stick as well, you have to worry about HIV versus hepatitis.
I'm the upgrade.
Whoa. Obviously, if I got hit like this, I would be having a lot of broken bones and not feeling well and not getting up anytime soon.
I'm not feeling good at all.
You really had me going for a minute there.
Crushing somebody's airway, you can cause enough trauma to the airway where it's difficult to get air in, as well as you're decreasing blood flow to the brain in and out by squeezing on each side. When we actually take someone's pulse in their neck, we actually don't take it on both sides. guy's strong. We have patients that are so strong, we have to hold them down with multiple different people. We have security at the hospital. You actually want to give them a medication that can actually just calm them down. Oh! I'm assuming they were trying to kill him. Whoa, cool.
Okay.
Get to the prostate.
So he shrunk down to then get to his prostate. Your prostate is a gland that sits just below the bladder, around the urethra. It produces the fluid that basically nourishes your sperm when it gets ejaculated out. Oh my gosh! I did not expect that to happen at all. Holy cow. We literally have like the tissue of the lower part of the abdomen still kind of wiggling and moving. What we don't get to typically see is like all the fecal matter. It's not really good for TV, but it's actually quite realistic if it was there. But most of this is just blood and intestines. Wow. So people come to the emergency department, significant amount of abdominal pain, and they always worry about their intestines bursting open. It could happen, but typically due to a perforation, the body is actually quite impressive that it can actually take a lot of stretch because all the organs, everything we have is basically like muscle.
Hi. Can you please break my arm? Vicky will smell it if I fake being sick, so it's gotta be real and it's gotta last for days.
Whoa. When they document really bad fractures for like people in the news, they always say compound. In the medical field, we never use the word compound. We use comminuted to describe if a bone is in multiple pieces.
That. Right here. Clean break, no permanent damage.
Clean break, no permanent damage. So trying to go like proximal forearm, you have your radius and your ulna. Those are the two bones of your forearm. What are we doing, like an Indian bird? Don't rotate. Snap. You kind of need a fulcrum unless you're superhumanly strong, which I know they are.
1, 2.
Wow. The likelihood that the bone didn't actually rupture through the skin is pretty low, actually. Because of this type of fracture, the bones snap and they're super, super sharp, and it would actually most likely rip through the skin with that much amount of angulation. Oh, ow! Could actually fracture the maxilla here or your infraorbital wall. If you have a fracture and you sneeze, the air that you would normally sneeze out actually then escapes into the skin and it actually just swells up really fast. Not good, not good. Oh, geez. Oh my gosh. All these characters are soups. They have a lot of power. But as mere mortals, how can we get an advantage? Check out my product, Level Up for Energy and Focus. The noises that whoever created this decided to make an exploded head just be like juicy.
Juicy.
These type of injuries typically don't come to the emergency department. Where would we normally see these? Gunshot wounds, and these are also like bad car accidents where there's like decapitation, bad injuries, that sort of stuff. Oh, geez. Punches epigastric area through the sternum on the left side. Everybody tells me in the comments that the heart is in the middle of the chest. It's actually in the middle left part of the chest. Blunt trauma to the chest can cause significant amount of injuries where it stuns the heart, it bruises the heart. If you actually have bruising to the heart or bruising to the lung, not good. It's not like the bruises that we see on our tissues. They did a good job of depicting this. Even though your heart stops, you will have a few seconds where there's consciousness, somebody will pass out, and then there shortly after, if nothing is done to fix it, you will succumb to the injury as you don't continue to have circulation.
God damn it.
If you have trauma to the chest cavity itself, increase the risk of fracturing a rib. A rib could then actually puncture your lung, causing a pneumothorax or a hemothorax or a combination of the two. Oh, somebody pulling her through a brick wall. I mean, if anybody gets thrown through a brick wall, that is a human.
I'm a human!
It's going to cause a significant amount of destruction to your body, break some bones, open up some wounds. Oh, jeez. Strangulation. Oh, actually, pretty good depiction. When somebody gets strangled, two different mechanisms are occurring. Blood vessels on either side. You got your carotid artery going up. You got your jugular vein coming back. And then you also have your airway. If you continue to hold after somebody passes out, that's when you have the increased risk of killing them. Oh, nice. See? Passed out for a second, but then was able to regain consciousness because able to get oxygen back in the body.
Was that an almond joy? He has a tree nut allergy.
Come on!
Come on!
How many of you out there are allergic to tree nuts? Let me know in the comments. That would be pretty darn fast to have an anaphylactic reaction. If you have a history of anaphylaxis, then you need to carry an EpiPen on you. Looks like there was an EpiPen there. Appropriate. Wow.
Homelander, wow, you're... It's an honor, sir.
Hold on. You can tell it's me? Wow. That's impressive.
Now, you don't need super eyes when you have super ears.
Good thing to quickly talk about. So we have all our senses, right? One is actually taken away, like Daredevil. Your potential senses on the other ones that are still intact are a little bit more heightened, and you're able to focus on them a little bit more.
I just have one question, if that's okay.
Yeah.
Yeah?
Yeah.
Oh gosh.
All right. So, what happens if, I don't know, I do this?
Oh! That is a significant amount of blood to come from somebody's ear. So what happened? Compressive forces, basically massive amount of trauma to the eardrums, rupture the eardrums. The eardrums have blood vessels, so you will start bleeding.
And now you're just another useless blind guy.
What could potentially happen now is permanent hearing loss, or it actually can go back to normal. You can actually have the eardrum heal, and most of the time they heal on their own, and your hearing goes back to normal. What the heck is that? Obviously, this does not come into the emergency department, but we do see people that get chest trauma the other direction. Kind of common thing that we do worry about is a car accident where somebody has a sternal fracture. Getting slammed on a table with glass files, you always worry about objects just being embedded into the tissue. Glass is such a pain in the butt because you can't necessarily see it. Sometimes we can use our tools to probe into a wound and you can feel it. Feel it, feel it! But they're really hard to like get a hold of. Okay. Smacking your head on a metal pole and then getting knocked out. You always worry about somebody's airway and their neck. Look at that neck! As well as obviously the head. So if you are a bystander there, call 911, stabilize their neck, get them out of harm's way. Oh! Okay, wasn't expecting that. Lots of the red stuff squirting everywhere. If somebody were to be separated in such a way, you would rip major blood vessels. Obviously, you all know this.
We noticed.
It's almost like they have it to the whole blood volume just dropped out in 2 seconds. A lot of it would drop out, but not necessarily that fast because it's everywhere in your tissues. But you see organs laying next to this individual. They're trying to depict most likely intestine, so you're gonna have small intestine, large intestine. The large intestine will probably still be kind of tucked and attached. They're all connected by mesentery. There's blood all over his face and probably into his eyes, into his mouth. You get worried about blood pathogens that you might have gotten exposed to. That's why we have OSHA here in the United States. You worry about, protecting yourself.
Most people, their brains grow till they're about 25, then stop forever. Mine doesn't. It regenerates constantly.
Oh, interesting. And as we get older, our brains actually shrink in size. You might not be able to regenerate your brain like this character, but you can support your brain function with supplements like Level Up by my company, Life Happens. Now at lifehappens.com and on Amazon.
Stab me in the heart, I die. Stab me in the brain, and the little grows back. I want you to put this inside me, in my eye, here.
What?
You give me a frontal lobotomy.
Ah, I was just about to say, one of the ways to do a lobotomy is going through the orbital socket next to the eye through, because the frontal lobe of your brain is accessed that way to a point.
Now, avoid the eye itself. I don't want to go blind.
Ah, see, so missing the eye, wanting to go next to it. Yeah. Shaky hands. Don't have a cup of coffee when you want to do this. Obviously, I'm not recommending anybody do this. Please do not do this. This is a show. We don't even do this in the hospital. Oh my! Come on! Come on! Eyes. Most people do not like eyes. My best friend's an ophthalmologist, and I don't know how he does it.
Now, use the hammer.
The hammer.
You're able to get into the eye socket, but using the hammer because you need to break into the bone. Oh my gosh, good noises. Not cool though.
It's not cool.
This is a blind procedure and you can cause injury to the optic nerve and the blood vessels back there as well as the muscles.
Again. Okay. Hammer down. Now. Scrape. Scrape my brains out.
What? Scraping the brain itself, causing injury to the right frontal lobe. So the frontal lobe has to do mostly a lot of times with voluntary movements, expressive language, higher level functioning, personality, those sorts of things.
Oh, God. Hey, are you okay?
Uh-huh. So, hey.
Yeah, so lobotomies are not performed today. Last lobotomy that was performed in the United States was in 1967, so it's been a while.
It's been a while. Oh, buddy, what am I gonna do with you?
What?
Oh, stop.
When I talk to people and I ask them about diarrhea, I literally ask them, are they like peeing out their butt, like liquidy diarrhea? But most people will also confuse like loose stools with diarrhea. Diarrhea is watery. What? What are you ripping through up top there? From the top shoulder over here, you got your clavicle, very easily broken. And I don't know if a lot of people out there have ever broken their clavicle. If you have, let me know in the comments. Oh, or rip the body in half. Connective tissue could potentially be stringy like that. We're not seeing any ribs necessarily broken, but you would break some ribs.
I don't need you.
We know he's super strong because he's actually even able to lift somebody up off the ground. A feat in itself, especially from your shoulders, and it looks like it's only one hand, so lifting that up, that's pretty darn hard to do. Oh, we knew that was gonna happen. Significantly torque and rotate to disengage the vertebral column and snap the spine is really hard to do. Probably the crunch is most likely related to the snapping of the connective tissue. Whoa. Oh gosh, what is gonna happen? They're gonna go right through it. Awful.
That's awful.
I'm assuming no creature was harmed during the filming of this. That type of impact at that speed, the passengers in the boat probably have massive amounts of injuries if you actually survive the impact. This is an event where the likelihood of survival is pretty low. There ends up being a lot of injuries that people get while boating.
I believe it was a boating accident.
Drownings or potentially infections due to the microorganisms that are in the water that you're in. And then you definitely have to be careful when it comes to the propeller. That is so powerful. It's like a small little fan, but going crazy fast. Ooh.
Come here, Ryan.
Now on your life.
Oh, we do get electrical injuries that come into the emergency department. You can get electrocuted by lightning, but more commonly, it's usually at like a workplace where people are like working on outlets or sockets and they get electrocuted that way, or with tools.
Get the away from my son. We love you, Ryan.
Oh, whoa, holy. Wow, the eye is now gone. You probably have a lot more water than blood come out. You probably have a combination of both. You've also now destroyed the back of the eye, which is where all the retina is, and your rods and your cones, so your ability to see is probably going to be now shot. Ooh. Sliced in half? What happened? Whoa!
I'm shot in the eye and the Apfelbums.
Good job of showing what the tissue actually kind of looks like when there's such damage to the area. Basically almost like ripping or torn tissue. You see bone, you can see different colors, so they're trying to depict different layers of tissue, which is good. Oh, punching your hand onto a hard object. A mere mortal will actually fracture the heck out of your hand, most likely. We have what's called the boxer's fracture, which typically relates to somebody hitting and fracturing either the 4th or the 5th metacarpal. Seriously. We have an eye gouge. The cornea, which is over top of the colored part of our eye, is very, very sensitive and has a lot of nerve endings, and it's quite painful. This definitely doesn't happen that often. Most of the time we see open globe injuries or open eye injuries due to lacerations, and you see some of the fluid coming out.
Is that how you want to be remembered?
Even just looking at this syringe, it's got like metal components to it. In the emergency department, we actually use disposable, one-time use type of thing. So the only metal per se with the syringe like this would be actually the needle. And then when you're actually done, you always dispose of it in the sharps container.
Last chance to look at me, Hector.
You can see that Hector has a nasal cannula on. It's basically a device that gives oxygen into the nose, and typically you're giving anywhere from 1 liter to 6 liters per minute of oxygen. Oh, got a bomb. Oh, what? I talk about explosions in the past. If you survive them, worried about obviously the shrapnel, debris getting into your tissue, ruptured eardrums, pneumothorax, hemothorax, those sorts of things. Wait a minute, how'd that guy make it out? Oh. Holy cow! Significant burn blast injuries. The eye is actually missing, and obviously we can see that part of the maxilla as well as the mandible on the right are partially gone. Oh, okay. Wow. Okay, so it was enough trauma that it must have inflicted enough injury into the brain and intracranial space, which probably caused some brain bleeding. But for some reason was able to, for a short period of time, get up and walk. Could this possibly happen? Possibly. Oh, box cutter, razor blade. I've seen multiple people come into the hospital with injuries that have been inflicted by this device. Wait, what? This is real? Is this the real life? Anterior laceration of the neck. It is in zone 2 of the neck, which is an area that has your most important structures. You have your carotid artery, your jugular vein. What? You can possibly hear him gurgling a little bit. There is a potential that you can cut into the airway. We do a procedure where it's called a crike, where you actually cut into the airway between your Adam's apple and another hard piece of cartilage underneath called the cricoid. The audio is awful. If this were to actually occur, you definitely want to put direct pressure to the area. Wow, okay. To bleed out and significantly affect your cardiovascular system due to not having blood, you need to lose about 40% of your blood volume super fast. If we're filled with 10 to 12 pints of blood, you need to lose 6.
Baby, I don't make any sense.
Of course it makes sense. Every safe's got its weak spot, right?
Oh my gosh.
No, jump!
Oh!
Jump, no.
Oh! What? Come on.
Come on!
Does anybody out there know how much an ATM weighs? You can have crush injuries to the head, compress down the airway, press on the neck. Could it be plausible that this might actually injure somebody so bad that it would take their life? Maybe. And of course, going for the white powder. We get people that come to the emergency department often. We do find drugs on them. If we do find it, we have to call security, call police, and hand it over.
Give me the drugs, Lisa.
I was trying to get his fingerprints off it. Oh my gosh, it came right out. Come on. What would you do?